2020 has been a difficult year for all of us, and COVID-19 has brought about the biggest public health challenge that many of us have experienced in our lifetimes. 2020 has also brought about a lot of new attention and awareness around air quality. Improved air quality during COVID-19 shutdowns highlighted the sources of air pollution and demonstrated how air quality improvements could come quickly when emissions are reduced. And while we recognize these improvements have come at a massive public health and economic cost, it's creating a demand for investments in green solutions and a call to build back better. Wildfires in the western United States have generated wide interest in timely, accurate, and accessible data on air pollution and risk, so people have the tools necessary to protect themselves and their families. They've also shined a light on the important links between climate change, air pollution, and public health. 2020 also brought to the forefront the socioeconomic disparities that exist in air pollution-related health in cities and the risks faced by vulnerable populations. And this is driving a demand for solutions that are equitable. People were talking more about air pollution in 2020 than I could remember throughout my entire career. For me, one of the exciting changes we've seen is the explosion of walking and cycling as a safe, low-cost, sustainable transportation option in cities. Mayors announced and built thousands of miles of new cycle lanes in cities in response to the pandemic, creating the infrastructure for people to move around safely. Cities like Bogota, Milan, and Paris, and others have been looking at active mobility investments as a means to avoid increases in air pollution levels as we recover from COVID-19. In 2020, we also continued to see the sobering costs of air pollution. The Health Effects Institute's State of Global Air found that nearly 500,000 newborns died in 2019 due to poor air quality, a striking statistic that should alarm us all. Emerging evidence has also been finding the links between poor air quality and severe outcomes from COVID-19. And these findings reinforce decades of research on the profound health impacts of poor air quality and should be a call to action for all leaders. For next year, I'm excited to see how the commitments cities have made are implemented and how the principles of a green recovery are put into place. Research in C40 cities have found that investing COVID-19 recovery funds in climate solutions could prevent hundreds of thousands of deaths due to air pollution. And finally, I'm excited about what a new administration in the United States brings for air quality, public health, and climate action in the US and globally. President-elect Biden has highlighted environmental protection and climate as a priority for his administration, and I'm eager to see what that means in terms of policies in the US and how that can influence action globally.